Welcome everyone. This podcast is designed to be a short introduction to the next webinar from the Child Safeguarding Practice Review Panel, which is going to be taking place on the 28th of January, it will focus on the child safeguarding incidents we saw in the context of the first 6 months of the COVID-19 pandemic. So in this video, we'll run through how we analyse the rapid reviews relating to children who died or were seriously harmed between the 1st of March and the 30th of September 2020, and where it was felt that there was a link between the incident and COVID-19. And we will begin to discuss the emerging themes arising from that work. So we encourage you to listen to this ahead of the webinar and contribute any thoughts you may have to the forum, which we will be using on the day to take comments and questions. I'm Sarah Elliott, and I'm one of the panel members for the Child Safeguarding Practice Review Panel. And I'm going to be speaking to John Harris, who has recent experience as a Children's Improvement Advisor and worked previously as a Director of Children's Services, who, along with Jeff DeBell, were commissioned from our pool of reviewers to undertake this in-depth case analysis. So John, welcome.
Hello.
Last year, a variety of organisations initiated research on child protection during the first lockdown. But what was different about the analysis that you undertook?
Well, our analysis was drawn from a unique evidence base, the multi-agency rapid reviews of individual cases of children who were tragically harmed or lost their lives during the pandemic and abuse or neglect was suspected.
So how did you make sense of all the information that was already out there?
Well, to inform our analysis of these cases, we looked at more than 20 pieces of published commentary and research on the impact of COVID-19, and we looked at evidence that gave us a range of perspectives, the direct experiences of children and families, for example, in reports from NSPCC and Children's Society. We looked at surveys with managers and practitioners, for example, the work done by the What Works Centre. We also looked at research into remote working that had been coordinated through the University of Birmingham. And there were some key impact studies around mental health, around early intervention, around the impact of school closures. We also looked at some medical evidence around the incidence of abusive head trauma from the British Medical Journal, and we finally had the witness evidence from the Parliamentary Select Committee. And when we took that together, that provided a window on the system during the first wave of COVID. We had one key proposition from this analysis, and that is that the effects of COVID presented a situational risk for vulnerable children and families in two ways, either by exacerbating pre-existing safeguarding risks or bringing new ones. And this was strongly evidenced in all of the cases that we looked at.
Thank you, John. So when the panel commissioned this thematic analysis, we had received over 300 rapid reviews between March to September 2020. 40% of those cases related to child deaths and the remainder related to serious harm. And at the start of the pandemic, we asked safeguarding partners to indicate whether COVID-19 was a factor in any of the cases that they sent to us. So how did you navigate all of this information and determine which cases to look at?
Well, the analysis of these cases required us to have a really rigorous case sample. And for the case sample, the panel had identified 44 cases where the rapid review had suggested that COVID-19 had been a factor in the case. And this sample of cases was a given for us from the panel. But to test our analysis, we looked at a sample of rapid reviews over the same period of time where the report had concluded that COVID-19 had not been a factor. And there were over 300 such reviews for us to consider. And what we did was to derive a sample that covered 40 cases in a range of contexts. Children not previously known to services, where the family was engaging in early help, children in need and child protection cases, looked after children, and we also wanted them to cover broadly similar safeguarding incidents. And there's a very full range there: non-accidental injury, sudden unexpected death in infancy, suicide, sexual abuse, incidents involving disabled children, criminal exploitation, substance misuse, and medical error. Now, the government had also issued guidance to local authorities about expectations in supporting vulnerable children and families during the COVID-19 period. And what we built into our analysis was consideration of the service adaptations in the light of this guidance and the extent to which those adaptations were a relevant factor in any of the cases that we looked at.
Thank you, John. And you mentioned there that you developed an analytical framework. How did you go about auditing each of the cases?
Well, we designed a bespoke audit tool to enable us to analyse the cases against the COVID-19 factors in our analytical framework. And within the audit tool, we obviously recorded the key characteristics of the children and the household, any previous work with the child and family by relevant partner agencies, the circumstances of the incident itself, and then we looked at the incident against the 4 key COVID-19 factors. And they were parental and family stressors, evidence of exacerbating risk for the child in the household or wider context, the impact of school closure, and the impact of adaptations for COVID safe practice and COVID working. We obviously piloted and refined the audit tool based on sampling of the first 5 or 10 cases. And all the way through, working with my colleague Jeff DeBell, we did peer checking to ensure consistency of the approach to the way we were undertaking the audit. So
rather like safeguarding partners, I guess then that you needed to rely on your professional judgment to assess the connection of each case to COVID-19. And indeed, with rapid reviews themselves, we rely on the professional judgment of professionals who work with children every day. So how did you ensure that that judgment that you and Jeff were making, how did you ensure that that was reliable?
We designed a framework for impact analysis. And effectively, there were a number of key questions there. So the first thing we were asking in our impact analysis was there a COVID-19 impact? And we were looking on the judgment there was whether the risks and decisions taken in responding to risk predated the COVID-19 outbreak or were not affected by COVID factors. The second thing then, so one judgment was COVID factor or not. If we did consider that there were COVID factors involved, we were then interested in which of the 4 COVID factors within our framework had an impact and what was the level of the impact. And we identified 2 levels of impact. So significant impact were cases where there was a strong and direct link between the circumstances of lockdown and the serious safeguarding incident. In some cases, we thought there was some impact, but it wasn't significant. And for that, we were saying there was an association between the circumstances of lockdown and the serious safeguarding incident, and that affected the capacity for agencies to respond to changing risk and need. So we had quite a precise framework in which we considered the incidents overall. And from the audits that we did, within the cases that we considered were relevant to COVID-19, approximately 75% had a COVID factor. And of that 75%, overwhelmingly, the impact was significant.
Thank you, John. So that's been a really helpful overview, hasn't it, of the methodology, the analytical framework that you needed to design to undertake this piece of work. So from that process, what are the emerging themes and key findings from the analysis?
Well, Well, I think it's very important to say at the outset, in terms of the overall findings, that there were good examples of safeguarding children partnerships taking learning from rapid reviews to make immediate changes to the way that they responded to vulnerable children and families during COVID-19. In relation to the key factors relating to COVID, in terms of parental and family stressors, this was a major factor across all cases. We saw evidence in many of the cases of underlying pattern and background of domestic abuse, of mental health concerns. Often another key factor was the loss of contact with families who were seen as a protective factor in circumstances of risk. And there were major pressures and tensions with overcrowding. And those factors in combination in a number of the cases led to very significant safeguarding incidents, particularly involving children under 1. There was a major factor in relation to non-accidental injury and sudden and unexpected death in infancy in particular. Second major finding really was in relation to school closures. And again, I think it's important to stress that we saw good examples of schools maintaining contact with vulnerable children during closure, but we also noted that there was low attendance from many vulnerable children entitled to attend. In some cases, parents had kept children at home because of the fear of risk of COVID infection. The impact of school closures was quite significant in terms of loss of structure and routine for some children. Children being at home full time added pressure for parents. That was particularly the case in a number of the disabled children that we looked at. And schools, crucially, were not available as a trusted environment in which children were able to disclose concerns and get support. The parental and family stressors and the school closures combined to create exacerbated risk for vulnerable children, and some vulnerable children remained, if you like, out of sight for relevant partner agencies. So very significant the way in which the interplay of these factors actually worked in these incidents. I think we should also say something about the adaptation for COVID safe practice. This was an important factor across all cases. Again, I think it's important to stress that there was rapid adaptation and innovation by partner agencies. Things like online referral and assessment processes, virtual multi-agency discussions, improved information sharing, and priority for face-to-face contact in the most at-risk cases. We also saw innovative use of virtual visits and using social media and other applications well. The key issue was the extent to which, in working virtually or remotely, professionals were able to pick up the subtle signs of abuse with the benefits of direct observation in the home and the capacity to recognise changing risk and need. And there were also limitations if families didn't have access to social media.
John, you've provided a lot of food for thought there for strategic leaders, commissioners and practitioners. And I'm really looking forward to hearing everyone's reflections and ideas to approaches to assessing and managing risk in the context of COVID-19. So thank you, John, for taking us through that analysis. So coming to our listeners of the podcast, if you've already signed up to the webinar, you'll have the access to the forum in the link in the email that we sent you, and where you can begin to input your thoughts on some of the findings. Thank you for listening, and we look forward to seeing you for the webinar event on Thursday, the 28th of January, 2021.